can see this, right?
Yes, sir.
All right, hold on. I'll ruin the punchline if I don't watch it. Okay. All right, these are you guys right here, right?
Yes,
All right.
sir.
Oh, shoot. Ignore the date. Sorry. 0. It doesn't exist. Okay. So I'm Dr. Graves. I'm an oral and maxillofacial surgeon. So, it's kind of, I have like the most confusing profession in the world. And the reason I say that is because, to be an oral surgeon, you go to dental school. But there's a lot of oral surgeons that go to dental school and they go to medical school. And if you look about, how we treat patients and how we bill insurances, it's a lot different than what a traditional physician would do or a traditional dentist would do. Oral surgeons work in the hospital a lot, and typically dentists work in their office, and in a private practice, you typically don't see a dentist working in the hospital, with the exception of maybe an oral surgeon or maybe a pediatric dentist. But we also bill like medical codes. So we do big procedures where we work on people's faces. We don't always just work in the mouth. We operate on all parts of the body. I mean, we take bone grafts from people's legs and their hips and their arms. We take rib grafts from people. Our primary focus is working on people's faces. But, if you look at the definition of an oral and maxillofacial surgeon, we pretty much do everything on the face with the exception of the eyeballs and the brain. And that's confusing because we do go to dental school. So we do learn how to do all this dentistry, and we do take a board to get a license where we have to do traditional dentistry, even though this is something that we're probably never going to use in our career. So, I mean, if you just look at the training as far as we're concerned, we go to the dental school. I went to the University of Louisville, Kentucky, and I graduated in 2004. And Louisville is just going to be a little bit north of where you are, McKenna, in Nashville. And then following that, I did an oral surgery residency. And these residencies, they vary from 4 years to 7 years. And I did that at the University of Tennessee in Memphis, Tennessee, which is not far from where you are too, McKenna. And I finished that up in 2008. And after 2008, I went into private practice. And I started this in Texas, and Amarillo is going to be in West Texas. So if you look at a picture of what Texas looks like, if you think about that in your brain, and it has that little bitty square on the upper left corner of it, Amarillo is going to be right in the middle of that. It's called the Panhandle, and it's kind of near Oklahoma, and that has a traditional looking panhandle symbol if you look at the map. So I started this back in 2008. About 7 years later, after being in practice and making a little bit of money and maybe building my office a little bit because I started it on my own, we built, one of the largest oral surgery facilities in the world. It is by far the biggest one in Texas, and it's about one of the top 3 biggest ones in the United States. It's about 17,000 square feet. And if you look at the traditional oral surgery office, the majority of those are only going to be somewhere between 3,000 and 4,000 square feet. So we're about 4 or 5 times bigger than, most oral surgery offices in the United States. Other than just a regular oral surgery office, we're also a surgery center. So we have a certificate from a national certifying company that goes in there, and we have, regulations that we go by that would supersede and far, exceed what a dental office would be or what a traditional oral surgery office would be. So we get this certificate every 2 years. We have full-time employees. All they do is make sure that we stay current on these certificates. We have an operating room. So the same operating room that you would have at the hospital with the anesthesia machine and the hospital bed, the same anesthesia providers. We have our own private one that we have in our office. So we do a lot of stuff at the hospital, but because we have our own operating room, we also do a lot of this stuff in our office as well. This is like a bird's eye view of what the office looks like. It has a very modern, contemporary kind of look to it. As I put the logo on the building up on the roof right there, and that was, when we built this, it was 2015. And, at that point, I just made the assumption at some point, everywhere you'll go will be based on Google Maps. and there'll be like a satellite view of everything. So instead of them having to put your name over top of the building, I was like, well, heck, we'll just go ahead and make it easy for Google, and we'll just put it right on the roof for them. So when you zoom in, you know where you're going. We did other things as marketing, and we changed the color of our building. I like to think of this as kind of like Las Vegas, or the MGM Grand. I'm from Kentucky, so the Kentucky Wildcats colors are blue, so that's why it's blue on the top left. We change it to red, white, and blue for the 4th of July. We make it pink for Valentine's Day, and it's actually pink right now because October is Breast Cancer Awareness Month, so we'll turn it pink for that. Last month was Hunger Awareness Month, and that their color is orange. So we had our building that was orange through the month of September. So it's just an ad. I mean, it's like a cool thing for me to do, but it's kind of like a marketing thing as well for us. We have a classroom in our office. So, we'll give lectures to other doctors. We'll give lectures to, dental students and dental hygiene students. There's a dental assisting class here. You'll see a picture of one of our ORs, but we have cameras in some of the lights at our OR, and those cameras will project to this classroom because we have a big screen in this classroom. So people can actually come in and watch me. You can bring an entire class in, and they can actually watch me do a surgery from the classroom. And we'll do that from time to time. This is kind of a picture of our OR right here that we have in the office. We'll bring in anesthesiologists and CRNAs that will come in and put our patients to sleep so that we can do more complex surgeries and jaw surgeries and different things like that. And we also have a full-time esthetician. So when I say that we do everything on the face except for the brain and the eye, oral surgeons do facelift, they do rhinoplasties. I don't do a lot of those major cosmetic procedures, but we do a lot of Botox, and we do a lot of lip augmentation in our office. We take a lot of buccal fat pads out. I think I have a couple videos maybe on our social media of us doing a couple of those procedures. And we have a full-time esthetician. So patients can come in, they can get a facial at the office if they want to. They can get cool sculpting. We do facial liposuction, those type of things. So it's a lot different than what you would think that you would have going to dental school. When I went to dental school, I didn't necessarily think I was going to be doing this type of stuff. Following that in our practice, we expanded. So in 2016, we started a pediatric dental practice. We now have 5 locations for our pediatric practice. We have 5 dentists that work in those locations. We expanded later on in 2020. Now we have our own dental offices. So we have oral surgery specialty, we have pedo specialty, we have endodontics, which is root canals. We have that specialty, and we have general dentistry that we do. We have about 15 different locations that we provide all these services. So as times grow and corporate dentistry is getting, really flooding the market, we've kind of adapted and changed with time by expanding the practice. I think what we did was we had a really good thing going with our oral surgery, and we had a really good business plan, and we do really good at marketing, especially with our social media, that we've expanded that, and we just apply those principles to, other offices that we have. So, I briefly talked about this earlier. What's the difference between a dentist and an oral surgeon? If you think about a dentist, with the exception of the residency program, we typically do about the same education level. The only difference is oral surgeons do an additional 4 to 7 years, actually, more than what you would do to become a dentist. But, once you become a dentist, it's kind of the basic stuff that you guys would expect dentists to do: x-rays and fillings and crowns and root canals and bridges. I think the thing that separates us is that everything I do is surgery. I mean, everything I do, there's bleeding involved in every procedure that I do every single day. Versus the dentist, you don't necessarily have to get a shot. You don't have to be numbed up for a lot of things that they do. You can go get your teeth cleaned, and that's a pretty painless procedure that you have. There's no recovery from having your teeth cleaned. Versus most of the things that I do, there's a little bit of a recovery associated with it. So, we do dental implants, we take out wisdom teeth, we do bone grafting, we do facial trauma. So if you get in a car accident and you break your jaw, we're the guys that fix that. If you break your cheekbones or you break your nose or the bones that go around your eyeball, we fix all those things. We do oral pathology, and that's a case I'm going to show you guys here in a minute. And we also do a lot of things called jaw surgery, and the fancy word for that is orthodontic surgery. And that's where people who have these bad bites. So if you've ever seen somebody who has like an underbite or someone who has an overbite, we do surgeries where we cut the jaws and we move them around to correct those things. So let's talk about a case real quick. I'll let you guys talk about this. So we're going to talk about a big facial tumor. And this is a case I did a couple years ago. You're familiar with the network TLC, right? Anyways, TLC came out and they filmed me doing the surgery. So there's some pictures, maybe some camera people in there. And some of the footage I'm going to show you is actually from their footage. So it was a TV show, was Save My Face, that they were thinking about having picked up, and it sounds like a TLC thing, Save My Face, right? That they were picking up, and it never went to the network, but they were shooting some footage for it. So we get this guy that comes in. He says, I got this large tumor growing on my face. He's a 64-year-old guy, rapid tumor growth over the last 2 years. It's non-painful. It doesn't hurt him. It's not numb. It's not causing difficulty eating or breathing or nothing like that. It just has some psychological effects. He has this big, huge tumor on his face. His past medical history is really benign, nothing to really worry about. There's nothing here that says this is the reason this guy has a facial tumor, right? He has high blood pressure. That's about it. And here he is. So this guy walks in. That's a big tumor on his face. He's been walking around with this tumor for the last 2 years. The reason he never had this thing fixed was he didn't have any money. He didn't have any insurance. I think he just had the, presumption that nobody was going to fix this for him, or he couldn't afford to have this thing taken off. So somehow he ended up in my office, and they just filmed part of a TV show a couple weeks before. And this guy came in, and honestly, you don't see these kind of cases every single day. So I would do this all day long, every single day for free, because it's a great case. So I called the guys at TLC. I actually sent them a picture, and they're like, yeah, dude, we're on an airplane. We'll be right back there. Because they're like, we definitely want to film this case. So this is a CT scan of it. You can kind of see, if you want to think of, you can see that little white area right here. I don't know if you can see my mouse. Can you see the mouse on there? So this is his spinal column right here. This would be his brain right here. And this is about the area of the brain. You notice how big this thing is. So it's about the size of his brain. So it's a humongous tumor. And you see how this is the skin right here as it's grown out. And these are little bitty vessels that are located in the tumor, those little white, little squiggly things right there. The reason it's black is because it's real radiolucent. So the X-ray beam goes through this without much deflection. So that just tells me that it's either air in there, which we know it's not because you can feel it, or it's something that has a lot of water in it, like fat. So, to me, I'm thinking, okay, this is a big fatty tumor by looking at this. And then that goes to our next slide, is when you see big tumors like this, you come up with something called a differential diagnosis. And all that is it says, okay, I don't know what this is in this guy's face. We're never going to know what this is until we take some of it out and we look at it under a microscope. But just based on what my gut says it is and where it's located and how long it's been there and how long it's been growing, these are two things that I think most likely that it is. And one's a lipoma, which is a benign fatty tumor, which means it's not cancer. And then you have a liposarcoma, which is a fatty tumor that's actually cancer. So to me, it's going to be one or two of those. So our plan on either one of those things, your plan is you're going to remove this thing first, and we're going to figure out what it is. And then based on that, we get the next level of treatment depending on what we need to do. So I'm going to play a little video for you guys real quick. There's some footage that we have from the actual case.
And I can't get back to sleep. And then just mess with his hand, just sit there and scratch, and it don't hurt. And then I never feel it, it's never give me no trouble.
Charles Hall is my ex-husband, but we are close friends still.
She take me places and do things. And if I need some help, she helps me. See, other than that, they just say the same old thing. This mom will be mad again.
I have to get most of his shirts and I have to cut them like right here. And I have to cut it so that way it'll fit over his head and with that big ball.
As you scroll through, you can notice, this tumor is about the size of the rest of his head. So if you were to measure this area right here, that's about the size of the rest of his face. Just this extra growth of tumor he has right here. So this is all grown this size in 1 year?
Yep.
Does it hurt?
No, it just don't hurt.
You got any numbness anywhere?
No.
Can you feel me touching right here?
Right there.
The thing that concerns me is as you kind of scroll down on the CT scan, this thing really goes pretty deep into its neck right here. Typically lipomas don't get this big. And if they do grow this big, this rapidly, they're typically a liposarcoma, which is the cancer version of what a lipoma is. Charles, do you have any questions about anything for me?
No, I don't think so. I'm ready to eat.
You ready to eat?
Yeah.
Yeah, I bet you are.
I am, but I'm hungry. I'm looking forward for surgery tomorrow, and I'm just looking forward to get it done. All right, here's our final weigh-in on our lipoma. Looks like we're at 3.6 pounds on this lipoma, which could be the world record for a facial lipoma. And looking at
So big old tumor, huh? So, we took the tumor out. The next thing we did, it was actually a Saturday. So this is one advantage of having your own surgery center is because, Charles didn't have any money and had no insurance, and the hospital charged this guy $100,000 for me to do the surgery. So, we do it in my OR and I don't charge the guy to do it for free. The disadvantage of that is I do it on a Saturday because, we're busy during the week. So that tumor I'm holding in my hand, I had to carry that thing in my car for like 2 days until the hospital opened so I could drop it off at the pathologist. So I sat in my passenger seat for like 2 days in a big, huge bucket until I could go to the hospital and turn that thing in. So there it is. And that's the bucket I had in my car right there. So, we send it off. It comes back a liposarcoma, which is the cancer version of a fatty tumor, of a lipoma. And these are extremely rare. Nobody really knows why Charles has this tumor. I mean, it could be radiation exposure. He could have a damaged lymphatic system, but more than likely, sometimes I chalk up some of these things to just bad luck. I mean, sometimes there's just such thing as bad luck, right? And the treatment of this particular liposarcoma is just to remove it. You don't need radiation. He doesn't need chemotherapy. Rarely does this metastasize to other parts of his body. And we did scans on him and he had no metastasis. The 10-year survival rate is 87%, which is an amazing number for a cancer. And the only thing we need to do, Charles, is we see this guy about every 6 months to make sure this thing's not growing back, and it hasn't so far. And pretty much his treatment is done. So one surgery, we've cured his cancer, right? So here's some before and after pictures. That one picture of him clean shaven, I like that picture, but I just can't get this guy not to shave his beard. So I got to work with what I got. So this is the picture before and after him with a little bit of facial hair. It looks a lot more impressive with him shaved, I think. So that's the case presentation. We'll talk about that here in a minute. We have a couple minutes left. The other thing that I want to talk about is, this is a charity case we did for Charles, right? And I enjoy doing these charity cases. And, by being a physician or a dentist or whatever medical field you go into, you're very blessed and you're very lucky to have that as a career. And you're very lucky to be able to help people for free, and actually you're lucky to get paid for it. I mean, there's a lot of things I do that some days I think to myself, somebody's actually paying me to do this. I would do this for free. And so you're very lucky. So, one thing that we've done, because we've been successful in our business, is we've started, our own nonprofit foundation. So we do a lot of community service and we do a lot of outreach. We have a nonprofit, it's called the Full Smile Foundation. So we do local community stuff. We do international mission trips. We do something that's called Full Smile Day, and we just actually did that a couple weeks ago. It's where we close our clinics down for a couple days, and we advertise and we invite people who have no money and no dental insurance to come to our office, and we do free dental care for those people over 2 days. And all our employees volunteer their time, the hygienist volunteers their time, all the dentists work for free. And it's just something that's part of the culture of our business. And I have a little video that kind of talks a little bit about the last one that we did. It's super short, real quick. We'll talk about that and then we'll answer some questions.
Every day, we at Full Smile look for new ways to give to those in need, to help put a smile on the faces of our community once again. That's why we created Full Smile Day. A day where we brought together doctors and volunteers, not only from our own staff, but from our friends at other dental offices as well, to give treatment to those in desperate need, no matter their financial situation.
So we put out an application around not only the Amarillo community, but Dalhart, Dumas, just to try to open the channels for everybody to see who actually needed it and what was needed. Today we're giving out cleanings, fillings, extractions, screenings, evaluations to people who haven't seen dentists in years, people who don't have the access to it, the money, the resources, the means. And we got over 200 applicants from around the communities.
So, that's something we do locally. We also do international trips. I know you guys are students. I don't know where you guys are in your level of education. I don't know if you guys are in dental school already or if you're in undergrads, but we do, it's called, it's a foundation where we go to Punta Cana. This year, it's December the 12th through the 19th. We stay at the Nickelodeon Hotel and Resort, so it's not like we're really slumming it when we're down there. I mean, it's really a nice kind of bougie trip. And we have dentists and dental students, undergrads, physician, nurses, dental assistants that all go to these events with us. We do free dental care in one of the communities in the Dominican Republic, and if you're applying to go to the dental school, the only thing I would tell you, or medical school, is that everybody has good grades. Everybody has good test scores. It's the extra stuff. It's the research that you can do that gives you an edge. It's doing these mission trips that give you an edge, because at the end of the day, if you're going for an interview for professional school, then you have a chance of getting in. They want you, you have the grades to go to that school. The interview is what determines whether they want you there or not. So if anything, this gives you something to talk about doing one of these mission trips. You know, the mission trip, I mean, this is our staff rate. And usually if I do like a podcast and somebody wants to do it, I offer the staff rate. The rate is usually about another $1,000, but this is what our staff pays to go on the trip. So it's about $2,000 if you don't mind having a roommate, and it's about $2,500. And that includes, you know, all your meals, all your transportation, all the activities, everything but the airfare. So you just show up, you get to the airport, and then we'll drop you off the airport later on, and you have to worry about anything else. And I tell people, you know, we have a foundation that does this, but on the podcast, if somebody wants to do that, I say you can contact me on my Instagram. It's just Dr. Graves on my Instagram. You don't want to send me a message on my TikTok, because there's no way I'm gonna get that. I get at least 100 messages a day from people, and just too many for me to check. The Instagram, I manage that. I get a lot less on those. All right, so that's all I got for you. You guys have any questions? Well, I got 3 minutes for you guys. Sorry.
It looks like there were a couple in the chat if you want to answer just a few of those.
Hey, can you just pick those out, what you want me to answer? We'll talk about it.
Sure. This one's a good one. It just says, what led you to pursue becoming an OMS? So was there a specific defining moment maybe that you had, or what made you choose this route?
No, I mean, look, oral surgery is fun, right? It's fun. So, you know, I went to dental school because I just wanted to be a dentist. And, you know, once you get to dental school, you kind of get exposed to a lot of different things, a lot of different specialties. And I remember going to oral surgery and thinking it was fun. I would go there in my free time if I didn't have a patient, or I would stay after hours and go to the clinic. And I just remember I was like, it's just a lot of fun. Being a dentist to me felt like it was going to be a job, and being an oral surgeon to me felt more like it was going to be like a hobby to me. So honestly, the reason I went into oral surgery is it was just something I loved doing.
Gotcha. So that being said, do you have a favorite surgery that you do, or a favorite part of your job?
I don't know. People ask me that. I mean, I've done it for 13 years. I've done everything 10,000 times at this point, right? I like doing unusual stuff. I like doing stuff like Charles, right? When something comes in the door that you don't see every single day, that's what I like doing. Everything else I've done so many times. It's just a part. Today I did implants. I took a bunch of teeth out on people. I mean, I do that all day, every day. It's the same old stuff. You know, if I see a patient and I look at their x-ray, I've said, I've taken your tooth out 10,000 times, you know? So it's the unusual, it's the weird stuff I like doing.
Good. And I say we'll end on this one. Carla just asked if you would recommend an MBA to pre-meds to enhance their understanding and managing a private practice. Do you think that would help, or?
I think it would help. You know, the way that medicine is going and the direction that dentistry is going is a lot of these big corporate practices are popping up. You know, right now it's maybe 16% of the dental practices right now are owned by a corporation. That number is going to go way up in the near future, right? So I think the days of people owning their own practices are, you know, getting far and between, right? So I think MBA would be great, especially if you wanted to own your own practice, because 10 years ago, nobody had MBAs. It's just nobody knew what the heck they was doing, right? It was like the Wild West running dental and medical offices. Now it is so much more, there's so much more skill, and there's so much more that goes into running a practice now. Your competition isn't the idiot down the street. Your competition is, you know, Heartland Dental, that has people with their MBAs in business and people with MBAs in marketing. They have CFOs, they have HR. That's who your competition is. And if you want to compete with somebody like that, you're going to need all the help you can get.
Right. Well, awesome. I don't want to take any more of your time because I know you have an event to get to.
All
but
right.
I do want to say thank you so much.
No problem. I enjoyed it. Okay. Thanks, guys.
Sounds good.
Okay. Bye.
Bye. All right. If the rest of you can stay on the Zoom call, I just need to go over a few things really quick. So thank you all for joining us today. I'm about to send the link to the Google form. Just a couple more announcements that we have. We actually have 2 events next week. we are going to be having an art and medicine lecture on Wednesday. So Dr. Massey is going to lead us through some different exercises she does with med students for diagnosis and stuff. And then we're also going to have another webinar next Friday. And we're going to do orthopedic surgery. We're going to talk to Dr. Sloan, and she's an orthopedic surgeon. And I can also go ahead and send the Zoom link for the art and medicine lecture. And I'm sure most of you know that this same link will be used for next Fridays. So be sure to tune